Now that we've spoken about nutrition and smoking, I'd like to talk to you about alcohol. It's something that I talk to all clients about. Is this something you've thought about, and have you made any decisions about alcohol in pregnancy?
Well, I haven't had a drink since I found out that I was pregnant, but I'm sort of concerned that I may have already harmed the baby.
Why are you concerned?
Well, I didn't know that I was pregnant, and I went on my friend's hens night and I just got really drunk. I had no idea that I could be pregnant, so I just didn't know. And since then I've been reading, and I found out that it could cause brain damage for the baby.
I understand your concern, and although we can't say what impact that alcohol consumption has had, we do know that the risk is probably very small. So I'd like to talk to you now about your alcohol consumption before pregnancy, if that's okay. Before you were pregnant, how often did you drink? Was it more than 4 times a week, 2 to 3 times a week, a couple of times a month, monthly or less?
2 to 3 times a week, probably, but it was only ever with friends and on weekends.
So when you were drinking, how many standard drinks did you have? This poster shows you what a standard drink is.
Maybe 1 or 2.
Great. And were there ever times where you had 5 or more standard drinks in one sitting?
Only ever on those big occasions, like my friend's hens night.
And how often would they happen?
Well, at the moment, maybe once every couple of months.
Wonderful. And you said before that since you found out you were pregnant, you haven't been drinking, is that correct?
Yeah, ever since the doctor told me that I was pregnant, I haven't touched a drink since.
That's great, because our alcohol guidelines tell us that that's the safest thing for you and your baby, not to drink in pregnancy.
But what about that one time? I thought you said that that was okay.
Yes, I understand your concern, but this is a very common thing for women to come to me in pregnancy and talk about. We do know that the effects of that one night are probably very small. So the important thing from now on is to focus on the rest of your pregnancy, that you're happy and healthy and you look towards a pregnancy without alcohol. The other important thing is that you think about your health and your baby's health. How do you feel about these things?
I guess I'm not sure what to say in those situations where everybody else is drinking. I'm not ready to tell anybody about the pregnancy yet though either.
Yes, it can be difficult when everyone around you is drinking, but perhaps you could tell one person who's close to you about your situation and you can discuss what to say together. Also, when you do decide to tell people that you're pregnant, you can tell them that you're looking forward to having the healthiest baby possible and that you've got all the information from your healthcare providers about what the best thing to do is.
Yeah, okay, thanks.
No worries. I'll also give you some information on drinking alcohol in pregnancy and why it's important to stay away. And also it tells you some tips on what to do in those social situations. And of course, if you need to talk to me at any time in the future, you can come back and have another visit.
Thank you.
No worries. It's important to open with a question like, what do you know about or how do you feel about drinking alcohol in pregnancy? These open questions allow the woman the opportunity to talk about her knowledge and feelings. Rather than tell the woman the health consequences of alcohol consumption, this approach, known as motivational interviewing, aims to find out the patient's level of knowledge and provide relevant information. There is no assumption that, if she just had the correct information, she would change. So it's good to make some general statements such as, a lot of women mention this as an issue, and sometimes women receive mixed messages about alcohol in pregnancy. This helps the women realise that they're not alone, and that it's completely normal for a health professional to talk about alcohol.